Good morning. It's 8:30 and call to order the Board of Franklin County Commissioners for meeting for Wednesday, January 11th, 2017.
Commissioner Howard?
Present.
Vice Chair Renaud?
Present.
Chair Waymire?
Present.
Commissioner Oglesby?
Present.
Commissioner Dunn?
Present.
If you would please stand and join me in the Pledge of Allegiance. Remain standing for the invocation. Be led by Reverend Craig Robertson, First Christian Church. Pledge allegiance.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Let us pray. Lord, we begin a new year. Opportunities to help, opportunities to do good for our community. I pray that you be with the commissioners as they decide the things that we need to help this community to grow and to do your will. Bless them, dear Lord. In Jesus' name we pray. Amen.
Thank you. Do we have any correspondence, organizational business?
Matt Hine is here to give a quarterly update.
Nothing.
Beyond that,
Nothing from the administrator's office? All right. Matt?
Good morning, Commissioners. I appreciate you guys always taking the time to listen to what's going on at our community hospital. And so, standard format, I'm going to give you guys a quick update. As you can see, the steel erection has started to take place. It looks a little, I think from my standpoint, it looks a little different three-dimensionally than it did two-dimensionally on a piece of paper. So it's fun to get out there and put a hard hat on and walk around and look at the progress. That project, as you guys are aware, is being paid for through our reserves, and so no debt has been taken out to pay for the construction. So we write checks as they come through on a monthly basis. There was some question about the helipad in the community that circulated quite a bit for a little bit, and so it is correct. We no longer have a helipad on site temporarily. We rally at the airport with our local EMS support. The long-term plan, as soon as we are buttoning up the construction of the building, we will put a helipad back on site. It'll be to the south and west of the new emergency department. Of note, when I talked to Lloyd Builder, who's the general on this, for trades that we have locally within Franklin County, we've utilized 90% of those. So trying to keep as much as of that business local as we possibly can. We are additionally looking at paving the northeast corner of our campus. We have a gravel lot, if you will, and that's going to have to be paved before the completion of the ER. So we're going to end up putting in about another 74 parking stalls back on that northeast corner, which will pull some of the traffic off of the roads. A lot of people are doing the on-street parking. If any of you have or want to put a hard hat on and tour, you're more than welcome to give me a holler, and I'd be happy to take you out there and walk around the project. We are probably a little bit ahead of where we are anticipated we were going to be as far as our timeline is concerned. We've had windows of good weather in between windows of bad weather, and so we've been able to get the trades coordinated in a way that has maximized the good weather. So I feel like we're on time, at the very least on time, if not a little bit ahead of our where we thought we would be. I think I reported last time that we obtained sole community hospital status. Really what this boils down to is that for our primary service area, we proved to the federal government that we're capturing 75% of all inpatient discharges. And in lieu of that, they improved the federal reimbursement for Medicare inpatient stays. So we've made that the case to CMS, Center for Medicare and Medicaid Services. They ultimately granted it. And besides having the additional reimbursement on the inpatient Medicare stays, it also proves a point that we are actually capturing a very large portion of our primary service area for care. The next step that what this opens up for us is another federal program called 340B drug pricing. Pharmaceutical drugs are increasing at a very rapid pace. It's hard to stay ahead of the latest and greatest drug, and they do actually do better jobs than the previous generation drugs. And so our physicians get a hold of them, and they are able to use them, and they see the improved outcomes that our patients get. And so we are seeing our prescription drug costs balloon pretty significantly. under Seoul Community Hospital in the 340B drug pricing program, we're able to tap into a significantly reduced rate of pay for our drugs. And essentially, once we qualify for it, and it'll be about an 18-month process to qualify, we should see about a $500,000 reduction annually in our overall drug acquisition costs. We completed our 2017 budget, went before the Board of Trustees in December. We've seen a tremendous amount of growth in many statistical categories over the last 2 years. We feel like that's going to, for the most part, start to plateau a little bit. We brought in several new physicians, and as they've ramped up their services, we've seen the growth across the organization. Now that they're ramped up, we tend to see them plateau a little bit. But as I mentioned earlier, we're trying to stay. It's difficult to stay ahead of the ballooning healthcare costs, so we're having to be very diligent on managing our expenses. With all that being said, we are projecting a positive bottom line for our 2017 fiscal year. We had a Joint Commission survey, so that's our accrediting body deemed by CMS to allow us to remain open as a Medicare providing facility. We had our survey, our final portion of that survey took place the week between Christmas and New Year. It came back with, the follow-up survey came back with 0 citations. They were very happy with what they saw. They applauded the healthcare organization and the leadership, and that's all levels of the organization. In fact, a couple of the surveyors noted that the facility is one of the cleanest healthcare facilities they've walked into. So that goes all the way down to our environmental services staff doing a good job for us. The last thing that I have to report on, Moyer Bunting, our CFO, he's retiring April 20th of this year, so we've got about 4 months, 3 to 4 months left of his tenure. In light of this, we looked at whether or not we're going to backfill him in a traditional manner, which would be getting a recruitment firm and looking for that individual and doing the same process, much like you guys are doing with your administrator position. So that's one opportunity for us to look. However, I think that in light of the relationship and the working relationship that we've had with Shawnee Mission Medical Center in bringing our board-certified emergency medicine doctors to the community, we're gonna work with them in a similar manner for financial management services. And the biggest benefit to this is it's going to save the organization money, and it's going to also drive economies of scale that we otherwise are unable to tap into as an independent sole hospital. They're part of a large system, so we have enhanced buying power, a larger think tank, so to speak. It's a contractual relationship. At any point in time, if we don't like what's going on, we can get out of it with 90-day notice, but we feel like this is going to help us propel us into 2017, 2018, and 2019 to shore up our financial performance and ultimately create a really strong financial foundation for the organization. That's what I have to report on. I'd be happy to answer any questions that you guys may have.
What's your total completion date of everything out there that you're doing now?
The sign says summer of 2017. I think the last day of summer is September 20-something, so it'll probably be right at that very last day. We got a little delayed early on in the process with the parking lot to the south of the hospital. That's what really set the stage for the delay in the actual groundbreaking of the main emergency department. We knew we had to get that parking lot in, otherwise we would have a parking catastrophe. So I would say we're going to be moving into the new ER the end of September, first part of October, and then the landscaping and other miscellaneous exterior items will take place into October and November. We're complete by the end of the year.
Okay, great.
Any other questions for Matt?
No, that's complete.
All right.
We appreciate your time coming in.
Thank you. Have a great day.
All right, public comment. Do we have anyone signed up for public comment? None. Consent agenda today would include considering approving the commission minutes for our meeting on January 4th, our reorganization meeting on January 9th, and our study session on January 9th. There are no tax change orders. Is there a motion to approve the consent agenda?
I'll make the motion. Second.
Commissioner Howard?
Yes.
Commissioner Renaud?
Yes.
Commissioner Oglesby?
Yes.
Commissioner Dunn?
Yes.
Chair Waymeyer?
Yes. First item of business is to consider a motion to approve neighborhood revitalization applications. Janet signed up to tell us about this.
So you guys have 5 applications in front of you, and the city's provided you all of the information on them, all the photos, all the estimates on current value and what they estimate the new values will be. They've been reviewed by the committee, and they're just before you today to get the governing body's approval on the 5 properties that, when they do meet the criteria, then they would be entered into the program. They have not met the criteria yet.
And we do this sporadically enough, make sure everybody's understands. The property continues paying the current amount of tax as a way to incentivize improvement or growth. Portions of the increment, the increased value after improvements are done, are rebated for a period of time, depending on its use and location.
And they do have to stay in good standing in their tax situation, or else they'll be removed from the program. So if they become delinquent past what our normal time is, which I believe the delinquencies take effect in late September or October. So if you haven't paid your property taxes by that time, then they would become officially delinquent, and we would remove you from the program, and you can't be re-entered into the program. So we have had a couple of those.
Any questions?
When this is all done, then it increases the assessed value of most of these properties, and they will
Yeah,
have a
like
greater
Colt,
tax
like Colt
value.
said, they continue paying the current level of property taxes even through the period that they're on the neighborhood revitalization program. And then they would get a portion of the, whatever the percent is of the increase in property taxes that they would have owed, minus the $50 fee that we take just for maintaining the program and, using our software for it, and the treasurer's time to write the checks, and just overall administration of the program.
I believe there's a 10% minimum for improved valuation, so. With that, is there a motion to approve the applications?
Motion to approve the applications.
Second.
Commissioner Renaud?
Yes.
Commissioner Oglesby?
Yes.
Commissioner Dunn?
Yes.
Commissioner Howard?
Yes.
Chair Waymire?
Yes. Our second item of business is to consider a motion to approve the fourth quarter 2016 financial and activity reports from the Health Department. Morning, Midge.
Good morning. Nice warm day. This is just a brief summary for October, November, December Health Department activity. Our normal busy vaccination time in the fall, as you can see by the number of vaccinations we provided, for the number of people we provided those to. It continues to be down a little bit from 4 or 5 years ago with all the additional places in the community that offer vaccinations, but we still offer a really important service in the Vaccine for Children's program that no one else in the community offers. So that's a really important part. We were fortunate to not have a lot of infectious diseases that we had to investigate this last quarter. We're glad about that. I'm a little worried about mumps being in Johnson County and Lawrence, but hopefully people will just stay home and we won't see any of that. We continue to have a few dog bites, a few mold complaints throughout the county. We have tried to beef up our involvement in the community. Aaron and Jessica both are out there doing a lot of work, as well as other staff members. So one of the important things we've been working on is the Breastfeeding Coalition with the hospital staff and some other individuals to try to increase breastfeeding awareness and policy, make sure organizations understand the state law, and encourage new policy, all in the name of better nutrition and a better start for our children in this community by being breastfed. So those are some of the other things we did. We did, in lieu of our normal annual staff training within the health department, I took everybody to a regional preparedness exercise over in Coffee County. It was part of our regional health department work, and that particular exercise was a functional exercise on doing mass care. How do you set up a mass care situation? What are the issues that might come up? How do you feed the people that come in if they're dislocated, and those types of things? So I think that was a good experience for all the staff to be involved in. As far as the financial picture, of course, the fall is a bigger, there's more revenue, more billings that go out. So as you can see, I can't see, but this is really small. So we billed $175,000, over $175,000 of in charges in the last quarter. And as usual, the majority of write-offs come in insurance contractual agreements of what they will pay us. So we had, over $15,000 of insurance write-offs, but we continue to see a higher percentage of individuals insured, which has been really beneficial for both our community members and for the health department as well. Nothing too unusual there. The software we put in over a year ago has made a tremendous difference in our billing, our rapid reimbursement rate, and less carryover between each quarter. So we would ask that you approve the write-offs for this last quarter, which again primarily are insurance write-offs of $16,396.45. And then I'd be glad to answer any questions that you may have.
Questions for Midge?
Yeah, Midge, you said that more people had insurance. Are you still finding people that don't have insurance?
There are, certainly there are those who are, adults particularly, who are at the poverty level below are uninsured because there's no Medicaid expansion. So those people are uninsured. And then there are those who are on the borderline who, even with the Affordable Care Act, the premium may only be $40 to $50 a month for that individual out of pocket, but it still may be too much for some people. There are also some criteria as to, you have to have some kind of income in order to get on that insurance plan. So, we still have people who are uninsured, but it isn't anything like it used to be. I mean, it's not as bad as it used to be. I can't tell you right now what our percentage in the county is, but it was around 13%, and I'd say it's around 11 now, so it's down a couple of percent.
Maybe the new plan that'll be coming will take care of this.
Well, we can always hope.
All right. So is there a motion to approve the activity report and the write-offs within it?
Make a motion to approve the Midge's report and write-offs.
Second.
Commissioner Oglesby?
Yes.
Commissioner Dunn?
Yes.
Commissioner Howard?
Yes.
Commissioner Renaud?
Yes.
Chair Waymeyer?
Yes.
Thank you.
Thanks, Midge. Brings us to our third item is to consider and approve the purchase of a 2013 Tahoe for the EMS department. Morning, Nick.
Good morning, Commission. We talked about this in detail on Monday. What my proposal is to put the F-250 pickup in backup status to respond just to extrication equipment while working on a plan to see if we can get that out of our system or involved in a more global system, and purchase a 2013 Tahoe so we can utilize SUVs as our first response vehicles versus having to purchase a bigger truck for that. So, any questions that came up since Monday that I can answer?
One question I have, Nick, obviously this vehicle is already equipped with some lights and so forth. We'll have to put our own logo, that type of stuff on. Anything else that will amount to much money or?
All we're going to have to do is put our logo on it and put radios in it, and it'll be ready to go.
Okay.
And we are going to have to purchase one radio. I talked to Alan yesterday. That was the thing that we're looking at with the new radio system, stuff like that. I hate to go out and purchase something that we don't need. So I've talked to Troy. We're going to have about $650 in expense for a VHF Moto Turbo. I guess the counties around us have went to Moto Turbo, which is Miami and Anderson County. So I'd be able to mutually talk to them instead of purchasing something that's not going to be useful down the road. We'll go with that. I have that money in my budget to do it, so I'll pull it out of my budget to pay for that instead of adding it into this.
I'm assuming this has a tow package, doesn't it? The Tahoe.
Yes.
There are no more questions for Nick. Is there a motion to approve the purchase of the 2013 Tahoe?
So move.
For a second?
Second.
Commissioner Dunn?
Yes.
Commissioner Howard?
Yes.
Commissioner Renaud?
Yes.
Commissioner Oglesby?
Yes.
Chair Waymeyer?
Yes.
Thank you, Commissioners.
Thanks, Nick. Our fourth item is to consider and approve the purchase of vehicles for the Sheriff's Department for 2017.
Morning, Commissioners.
Morning, Sheriff.
We also discussed this one on Monday during the budget process for this year. There was money that was approved for the purchase of vehicles. However, that money, after the budget cycle was done, was not placed in the sheriff budget. It was placed into capital outlay, and that's why we're here today, is to seek the authorization to go ahead and make those purchases utilizing a budget that is not directly under my control and authority. So, again, just to recap, we had one vehicle that was totaled in a vehicle crash, and we have received payment from our insurance company on that. My understanding is that money goes into the risk management fund, but that money is there. So as a result of that, we will only be trading in 3 vehicles instead of 4, since one has already been technically taken out of the cycle there. And that is for those vehicles. There were some questions Monday about the DEU vehicle and about the possibility of purchasing that out of forfeiture funds. We only maintain about $4,000 in that fund, and those funds are used for us for buy money and for phone expenses and some other things that come up. We would like to be able to do that, but over the past few years, we've not had that fund at a level where we've been able to purchase a vehicle. What we are looking to purchase is not a new vehicle. We just want a used vehicle that will blend in. But that was the purpose of that, and if that would be a conversation that we want to have, then that's fine. But that kind of addresses some of the questions that were asked of me on that. So.
Any idea on an amount or budget for?
Well, we had requested it during the budget cycle, 23.5. The idea is that we would hopefully be able to get one even less than that. We're looking at maybe a surplus vehicle or a used vehicle someplace. Typically, if we buy a used vehicle that we would use in this capacity, we would not make that a local purchase. We would purchase that outside the county so that nobody locally can say, well, the sheriff's office just bought this vehicle, and then the word would get around. So we would make that. We do like to buy locally, but for that type of purchase, for safety reasons and security reasons, we would make that purchase outside of the county. So, and I do believe from the dollar amounts that we discussed with the clerk, the money that was earmarked for vehicle and equipment purchases that was transferred to capital outlay was more than enough to cover the fleet request that I had submitted at that time. So
There were other fleet vehicles coming up from other departments in that amount though too, weren't there?
Well, that I don't know, and looking at the amount, it looks like 231 was moved, and certainly it appears as if 4 vehicles were part of that, and then the 5th line appears to be a planning and zoning item. So certainly I can account for the 4 patrol vehicles, but I don't have paperwork indicating that the DEU vehicle was earmarked with those capital
And as I discussed before the meeting with Commissioner Howard, at the end of that budget cycle, I did not receive any direct feedback as far as, there was a breakdown saying, I was not told what was approved and what was not approved. It's kind of why we were having some of this discussion. There was a breakdown somewhere, and that information did not get relayed to me. So that's kind of why another reason we're here.
What, is there issues with the DEU vehicle at this time?
Just maintenance. We've had a lot of maintenance expenses on that vehicle.
What year is it, Sheriff? You know?
Do you remember the year of that? Yeah.
It's in front of us here.
Is that a 99?
F1 2006. F-150?
Well, we have two F-150s.
Okay. The one
The
that's
2006.
the DEU vehicle.
The 2006 would be a detective vehicle. I don't think that I don't know, maybe the DEU vehicle is that new as well. It has 130-something thousand, 140-something thousand, I think.
So Derek, is the amount that, you said around 231 that was transferred over?
Appears to be 231, yeah.
Will that handle the 4 patrol vehicles and a DEU?
It likely would, yes, but I can't verify that when John transferred that, he was contemplating a DEU vehicle, because what we've got on this summary is what appears to be a planning vehicle. And well, Larry's not here, so at this time, I don't know what that was meant to be. But yes, the 231, again, depending on the price of the DEU vehicle, should cover that as well.
Does it leave us anything for a planning vehicle?
Probably not, no. I mean, it's looking like the 4 patrol vehicles, at least as budgeted here, are gonna come out to a hair above 200 grand. About 204 is what I have, and that would leave 27,000, which is exactly what we've got budgeted for the planning vehicles.
You have, I'm sorry, you have 204? Because I had 186. The 204, I have 186 for those 4 vehicles is what I show. I could be, I'll take the.
I think when we first started talking about it, the 180 something was what we were gave.
Yeah, and I am basing this, frankly, off of this fleet request summary and the amount that we have down as a replacement cost.
So you want to approve the 4 today and look more into the other situation?
I would feel more comfortable if I had some time to talk with Jeff and Janet about the DEU vehicle, figure out more what this planning staff vehicle, talk with Larry about that, and then bring the DEU purchase back to you guys.
Should we talk about trade-in compared to Purple Wave? If we were paying sales tax, obviously you'd want to trade in to less than that amount, but
Yes.
we're not. And, anything we trade to them, they're going to have to give us a price they can make money on it.
Yes.
So, and what Purple Wave's consistently been bringing pretty good,
We've had decent
Prices.
luck on the vehicle, on most of our vehicles. The last seized vehicle that we had, again, as we discussed Monday, we had to have a seized vehicle that we weren't going to be able to use for anything, and we put that on Purple Wave, and it did not bring in hardly anything. Actually, with the money that we had to put in it so that we could get it driven at all, we kind of broke even on that. So I guess you were running a risk. The only thing with the trade-in is that it's a guaranteed amount. I guess we could look to see what we're going to get for it and then make a decision from there. I'm not opposed to that at all. I don't see there being a problem. What you're saying makes,
as long as I
especially
guess
for
the
tax, that
offer's
makes
not
sense.
contingent on the trade-in.
Yes, yeah.
But, I don't know.
What was the dollar amount you had written down, the what?
I have 186.
Okay.
because we had, that's what we estimated. We estimated 46,000 per vehicle. That's the vehicle and the additional equipment that has to be put in it. And then one of those vehicles at 48,000. That's because that was intended to be a new K-9 vehicle, and the transport part of that for the K-9 does cost more money.
And in looking at the specific budget requests submitted by Sheriff Richards, they totaled at the 186. And that is different than what, again, we've earmarked on this summary, but yeah, it does appear that the amount would be 186.
Okay.
Well, in order to keep your budgeting information correct, it would appear to me that we would transfer the 180, if we approve that, to the sheriff's department and then proceed from there. Is that what you would say, Jeff? I mean, is that?
No,
No?
no.
Okay. All right.
The money is in capital outlay right now, which is a general fund account.
Okay, so we're gonna pay it out of general.
It's still like in the big pool that the sheriff is in.
Okay.
So we don't need to transfer that anywhere.
Okay.
And then that kind of messes with the sheriff's numbers from what he has. There's no movement there. We would just
Okay.
pay it straight out of the capital outlay account.
So the 186 then would cover, there wasn't any other money coming out of your department to help with that of money, you're saying?
No,
That was strictly-
and the reason that was explained to me as to why it was not placed into my budget and why it was placed into a different general fund was that historically we've had some problems because we budget these about a year out, and when our prices are wrong and it comes in higher, it was killing the budget. And the reason I was told that it was there was because we're still going to make that purchase, but it wouldn't reflect negative
Right.
on my budget.
We
Now,
probably
whether-
will have to make a change for that this coming year, just due to the new tax lid, and
Yes.
public safety items are not under the tax lid. So if we budget for that in the coming year in capital outlay like we did this year, then it would be under the tax lid. Whereas if we put that over into Sheriff Richards' budget, we're going to be out of the tax lid on that.
And it
So-
will be much easier to track if we put that back in
Absolutely.
to the budget and into that line. It'd be a lot easier to.
Well, that's
track.
what I think too. In order to track the money, then we ought to know where it came from, whereas otherwise going to the pool, then you got to break it out from there.
I agree with
Yeah.
that, but that's kind of where we are.
Right, I
on
understand
this-
that,
Just
yeah.
this budget year, but I agree with you.
I think the most important thing in this was you were told the money would be transferred to a different fund, and it was transferred to that fund. So
Not to the fund that I was
That's-
told, but yes, the clerk did find what fund that did go to.
So anyway, it was done, so.
Yes, yes.
So
Just a
you'd
quick
be-
question about the money from the fourth vehicle that went to risk management. Are we going to be using that money that went to risk management against these vehicles and then the remainder out of capital outlay? Was that what the discussion was?
I think it should be. That would have been money that would have been on a
trade-in.
trade-in if we had had it, so
Okay,
I have no.
to me, that,
idea.
I would have
Makes
used that.
sense.
Right.
okay.
Sure. So you'll be buying these at state contract price, which has already been competitively bid at a state level.
That is correct.
So
The fleet sales at Advantage Ford we work with them. They're able to, Ford allows other dealers to sell at whatever that state contract price is. Last year, I believe, we may have even been a little bit more competitive than what the state cost was. They've been good to work with for us.
and then I guess we could ask them what they'd give us for trade-ins. Quite frankly, they're gonna take them from us, send them to an auction. They're not the quality that they're gonna put on their lot, so.
You're correct.
They're gonna need to make money off of that. I would just say go ahead and send them to Purple Wave and we'll send them to an auction.
Okay.
But,
would agree with that.
everybody else?
We can intend on doing that, so we can
Okay.
get that done.
All right, so, how do we put all this in a motion? Do you wanna, summarize, I guess, what,
So I have that we're going to purchase 4 vehicles and we're going to dispose of 3. And we're going to pay for this out of capital outlay, except for that went to risk management for the vehicle that was wrecked. And our estimated cost for this is $186,000.
perfect. Is that what everybody agrees to?
And that just, I don't know if you need to put it in there to
That's
clarify.
estimated costs.
But it's not just the vehicles, it includes.
And the equipment.
And outfitting.
Yes.
I would make that motion.
Second it.
Commissioner Howard?
Yes.
Commissioner Renaud?
Yes.
Commissioner Oglesby?
Yes.
Commissioner Dunn?
Yes.
Chair Waymeyer?
Yes.
Thank you, gentlemen.
Thanks, everyone. Pitching in on that. Brings us to staff reports.
And while I have the sheriff up here, as you all may recall, the sheriff's office contracts with the city of Pomona to provide law enforcement services to the city. That contract is expiring here a week and a half or so. On talking with Jeff and the city of Pomona, both sides desire to enter back into that arrangement. So I'm just getting you all out ahead of this. Next week, I will have a revised contract on the agenda. To the extent you have any questions about how that went, Jeff is obviously here and can answer that.
Could I comment on that? You bet. Historically, the way that that contract is written, how the county has arrived at the dollar amount that is there, is it is an average of the salary, and it includes those that could potentially be working out there. So the lowest paid deputy to the highest paid sergeant. HR has made an average of that, and so we charge them in that contract what that salary is, and then she puts some, I don't know how she comes up with the amount to offset some of those benefits. There had been talk a couple of different years about increasing what that is to include the fact that, because essentially they're paying for one deputy. But we also have to provide a vehicle and equipment and all of that for that to fulfill that duty. There has been talk off and on about adding some of that and breaking that out. Most times a vehicle and that equipment lasts about 5 years, so dividing that out to add that in. That has not happened, but I know it's a conversation that has been had a few times and it's been discussed. So I just, full disclosure, wanted you guys to know that is something that has been discussed, but it's never been moved. So that I just don't want you to be under the misunderstanding that we're getting that the city of Pomona is reimbursing for any of that, because essentially it's just the salary and benefits that we're being reimbursed for at this time. So.
But if we did not have that contract with Pomona, would we not at some time, rather our deputies be going through there and whatnot?
That's correct. That is correct.
Just like we do the other little towns that don't have that.
That is correct.
So.
That is correct. We would still be doing that, and we would still need the equipment. We would need all of that anyway.
And because of that, I really feel that for those outlying areas in our county, we're responsible to some degree, and I would not, it's not an equal voice. I mean, we're still doing something anyway, so.
I agree. And the way that it is set up now, we just dedicate a set amount of hours per day out there, and then over and above that, we do respond to anything that's
Sure.
that is, and it doesn't count towards the contract time. So you are correct. The only reason I brought it up is because I know that it was a conversation that had been had in the past, and I wanted you to all know that had never been, no one had ever moved forward on that. So that's not where we're at today.
One other thing, Jeff, some of the small towns are talking about enforcing city ordinances by the sheriff's department. Does that conversation come up?
They're having meetings about doing that. Again, it requires a contract for that to happen. That's part of the reason for the contract with the city of Pomona. Deputies write traffic citations and ordinance violation tickets, which go through their court. But the only way that we can do that to enforce their municipal ordinances is if we have a contract to do so. Because we enforce state statute. We can still enforce state statute in their city, but they have city ordinances and that they want to go through their court and things, and we can't do that without having that contract in place.
Okay.
But the other city, what you're talking about, would be that the other cities are hoping to get on board to have something themselves so that there would be a municipal court for all those other cities as well. And they're very early in that process.
Does that court time that might be responsible for any deputy that wrote those tickets, does that count against their time then as far as coverage? No.
No, it does not. It does not.
So that's another resource expense to the county.
It is. Also, if someone is in, I don't believe I think as part of the contract, I don't for sure, but I think it covers if we have someone that is in the county jail on a Pomona municipal warrant. I believe that, I don't know that they are charged that back. Whereas the city of Wellsville and city of Ottawa, we do charge, they are charged a set amount per day per inmate that are in the jail. I don't believe that we do that for Pomona, since we do their enforcement.
No, this isn't public comment, Gene. You can ask him questions privately after the meeting. How's Public Works?
We're in the process today of replacing our friction material in anticipation of the forecast.
Do you have enough salt, or are you getting chips?
Chips.
Chips. Good deal. Nothing? Brings us to commissioner comments and board reports. I guess I'd start by saying, of course, former Commissioner Ed Taylor passed away, and I know we've all expressed our condolences and gratitude for the time he spent here privately, but his commitment and what he's done for the county and his years of service certainly deserve a public nod in that same respect. So wanted to take the time to do that. I know, Roy, you spent more time with him than anyone else, and you've talked to the paper, but maybe I'll put you on the spot if you have any words.
Ed Taylor actually asked me if I'd run for commission back in 2004 because Fred Ferguson was retiring off the commission, and so I threw my hat in the ring back there in 2004 with Ed's encouragement. And anyway, he sort of mentored me during those first years as being on the commission, and at the same time was finishing up the 36-mile project, and Ed was kind of leadership on that project. Also, we was changing to management form of government shortly after I got on, and that created a lot of turmoil and kind of a mixed approval to do that. But it was done by referendum by the public, so we, had to go through and make that change, and not only make the change to go to management form of government, but also we made the change to come out here to the annex and create this meeting room here and administrative offices as a result of that change. So it was a time of turmoil, time of change. Got our first administrator, and that didn't work out. And then we had another administrator, and that didn't work out. And finally, we settled on Lisa Johnson to be our first our administrator, and that worked out just fine. But also, at that time, I served with Colton's grandfather on the commission too. Really enjoyed his input too at that time, and appreciated him being on the commission too. But Ed Taylor, he was also an outdoorsman. He loved to hunt and fish, and went all over the world to hunt. And he enjoyed youth programs for hunting and turkey and also deer. So he was a very rounded person, and a member of his church, and is a leader in our church too. So not only do I miss Ed as a friend, but also he was a great public servant during his time, 12 years on the commission.
So I've always kind of thought of county government. I think we would all agree that we're maybe in a better spot now than we were 5 years ago, certainly 10 years ago or 15 years ago. None of that happened because of us entirely, or one person, but it also really didn't happen in spite of us. So
One of
I
the
think we
things,
quietly improved ourselves, and he's been a big part of that.
one of the things that was a real benefit to the county was, we was looking for a juvenile detention center back then too, because by state statute, juveniles couldn't be inside of the adult prisoners, and so we was sort of on the hot seat trying to get some sort of arrangement for our youth offenders, and we even made a trip out to Longmont, Colorado to look at some detention centers out there, and we was looking around the county for a good place to have a detention center, including up on the hill where the Elizabeth Layton Center was, and then Neosho County Junior College decided to build a new campus out on East Logan Street, and there was a nice building there, and with good foresight, the county bought that building, and not only was a place for the juvenile detention center, but it also, during our recent remodeling of that building for the sheriff and county attorney's administrative offices. So that was a fortunate happening for the county to have that facility available for the county, and solve several of our problems, and create more room down our adult detention center to add more cells there, so we don't have to farm out as many prisoners. So that was a good change too. And also in that time, it was 59 Highway. It was being discussed there in the early 2000s about its route through the county, and how it was going to affect the people along the route. And with Ed's Taylor input and the rest of the county's input and the city of Ottawa's input, I think we got a pretty good access to Ottawa off the new 59 Highway. We had to work hard for every access road and every parallel road, so it was compatible to the county roads to get around the new highway construction. And that construction took about 12 years before it was finally done, and I think we all managed the construction process pretty well, and it's a great help for travel in Franklin County and this part of the state. So it's something that needed to be done, because 59 Highway was getting awful dangerous going to Lawrence. So there's a lot that happens in the tenure of Ed Taylor's time on the commission.
Thanks. Any other commissioner comments, board reports?
I haven't been to anything since the last meeting.
I went to the Lane City Council meeting on Monday night. A lot of discussion over landowner responsibility as opposed to city responsibility when it came to sewers and water lines and water meters freezing up and so forth. I had intended to go to the Rantoul meeting afterwards, but they'd already completed their meeting that night. And yesterday I went to the Wellsville Chamber of Commerce meeting. Talked a lot about plans for the year. A lot of discussion about Christmas lights for this coming fall, winter, next year, the end of this year, and trying to implement some programs where maybe some businesses and people, public nonprofits could find an area and display lights in a public display rather than at their homes or outside of that area, such as the city park, that type of stuff. So there's quite a bit of discussion on that. Tonight I have Wellsville City Council meeting, so we're doing that.
Did attend the Chamber of Commerce Board meeting yesterday. There was lots of talk about the CVB and how the changes going on out there. Straightening out all the bills and accounts and all that good stuff. And John Cohen did announce that they were able to retain Susan Rader, who was the director out there. She's going to remain as now a chamber employee. There's still some discussions going on with their volunteers that were there before and trying to work with them and keep them. There's still some discussion about how that's going to look, whether they're going to reestablish a board and when that's going to happen, and how all that's going to fit in, and who's going to have seats at that board, and you know, places there. The former volunteer board that was there did give over the social media accounts for the new CVB out there, and that's all in transition. The web page will be in transition in the future after the release of a project that their volunteers have been working on. Then John Cohen discussed that there's some rental space above the chamber building that is going to be made available, and what that might look like, and the building itself. There were new members added, 4 drops. And then there was some discussion or reminders that were given to us about the charrette. Will be on the 13th of this month at RMH from 8:30 to noon, and then the 17th at Elliott Hall from 5:30 to 8 p.m. to discuss the vision for downtown Ottawa and what that might look like, encouraging people to come and be a part and express their ideas so that we get a bigger picture of what that might look like and what we might want to see downtown. And then the reminder of legislative coffee this Saturday, the 14th, at 10 o'clock to 11 at City Hall in Ottawa. And then to RSVP for the Ottawa Area Chamber of Commerce annual banquet the 31st, which will be at Ottawa University. So.
All right. Roy, did you have any board reports?
No board reports, but I did go to a meeting out at Pomona last Wednesday. There's a site meeting for Mid-American Nutrition. It was a meeting of the partners. Liz Maxwell was there from Area Agency on Aging. Had a lady there from the district. Had a lady there that manages Radish Patch. Gene was there as a consumer, and they're looking at ways to try to increase attendance there at the meal site for seniors, and that was the main reason of the meeting. And they're looking at ways to try to, justify having a nutrition site there and get more people involved. So they're going to send out notices in the water bills and try to get a hold of the rural water districts in that area to give notice in their bills that it's available and what the criteria is and when it is and all that. So they're trying to save that nutrition site to get more attendance.
Did you have something?
I just had something to bring up. Last meeting at the reorganizational meeting, it was brought to our attention after the meeting that there was a board that Commissioner Harris had been representing us on, I believe out of Topeka. I don't remember the exact board. Heartland Works. We didn't address it. I mean, I don't know how we want to go about it, if we want to look into whether we did and just notify them or that we would be.
Reached out to them and left a message with them, so we're in the process of
Okay, I just didn't know where we went with it after it was brought to our attention. That's all I had.
All right.
Speaking of that, the Area Agency on Aging, they do have a slot available to an elected official. It doesn't have to be necessarily a commissioner on their board. They meet just 4 times a year. They have a policy board, and then they have an advisory board. And I've been on the policy side of that group, and they meet at the same time, the same place down in Ottawa. So if any elected official wants to, do that, be a commissioner or somebody else.
Or sheriff.
No, I'm just putting that out there.
The sheriff could appoint the undersheriff. I mean, it doesn't have to be that elected.
All right. This brings us to our request to enter into executive session for a matter regarding non-elected personnel, 45 minutes. And for 45 minutes that include the board and the counselor.
Stake 5.
All right.
Make a
We can
motion, we
start
go into
that-
executive session at 9:30 for 45 minutes for matter regarding non-elected personnel.
Second it.
All in favor? All right. All right. We'll start at 9:30.